Welcome to the EADV podcast, the official podcast of the European Academy of Dermatology and Venereology. I'm Adriana and I'm your host. Every month, the JEADV chooses and highlights 4 articles in a section called Editor's Picks, and today we explore the Editor's Picks for May 2024, selected by the JEADV Associate Editor, Professor Joe Lambert. Non-Invasive Differentiation of Nail Disorders, Phosphodiesterase 4 Inhibition in Hidradenitis Suppurativa, Beware of Computer-Guided Melanoma Detection, and Exploring the Mind-Skin Connection. Remember, you can find a link to these open access articles that are discussed in our show notes.
We are excited to announce you can now register for this year's Congress hosted in Amsterdam and online from the 25th to the 28th of September 2024. The EADV Congress is one of the largest international meetings in Europe focused on dermatology and venereology, and the packed 4-day program covers the entire spectrum of specialties. This is an excellent opportunity for you to join delegates from all over the world and exchange knowledge, network with like-minded professionals, and develop your career. Find out more at eadv.org/congress.
And now, the editor's picks. Article 1. Non-Invasive Differentiation of Nail Disorders. The nuances of differentiating nail disorders can challenge even experienced dermatologists. Eichenboom et al. Evaluated a non-invasive diagnostic tool, line-field optical coherence tomography, with vertical, horizontal, and 3D images, similar but deeper than confocal laser scanning microscopy to assess nail disorders. 16 patients with various nail pathologies, see Figure 1, were examined to identify preliminary distinguishing features of various nail diseases, in order to assist with differential diagnosis. Larger studies are needed to determine if in vivo diagnosis of nail diseases may avoid needless biopsies with the risk of nail dystrophy, thereby improving patients' quality of life. Article 2. Phosphodiesterase 4 Inhibition in Hidradenitis Suppurativa. Orismolast is the second oral phosphodiesterase 4 inhibitor, after apremilast, to enter the test arena in dermatology for psoriasis, and here in this work for Hidradenitis Suppurativa by Fredrickson et al. In week 16 data from a small phase 2a trial, orismolast was tested for treatment of mild to severe HS in 20 adult patients. In terms of efficacy, Hidradenitis Suppurativa clinical response responders, the proportion of no increase from baseline in abscesses or draining skin tunnel count, was within the range of Hidradenitis Suppurativa clinical response achievers to adalimumab and secukinumab. At the right dose regimen, orismolast may be a promising treatment for HS. See Figure 2. Article 3. Beware of Computer-Guided Melanoma Detection. A current hot topic in early melanoma detection techniques like deep learning convolutional neural networks is to improve it beyond conventional dermoscopy for better examiner sensitivity. Gossinger et al. Compared the repeatability of computer-guided risk scores when classifying 5 sequential dermoscopic images of identical lesions using 2 CNNs in indirect comparison. See Figure 3. Their results suggest that CNN robustness must be further optimized, as risk scores only provide a diagnostic benefit for physicians if they prove to be both valid and reproducible. This is a reminder for dermatologists still to be somewhat cautious in fully relying on these tools. Article 4. Exploring the Mind-Skin Connection. A narrative review by Suarez et al. On the mind-skin connection explains how the vicious circle between psychological stress and inflammatory skin disease in both directions can be explained. They show data indicating a relationship between inflammatory cytokines in the blood and depressive mental states in patients with inflammatory skin conditions. Indeed, the brain and skin communicate with each other through several pathways, and the authors also shed light on the role of the gut in this. See Figure 4. Altogether, food for thought to further develop educational, for example, lifestyle and stress reduction programs, and a new drug target discovery for patients with chronic skin diseases. And just to recap, our first article was Line-Field Confocal Optical Coherence Tomography for the In Vivo Examination of Nails, Analysis of Typical Features for the Differentiation of Nail Disorders by Eichenboom and co-authors. Our second article was Orismolast for the Treatment of Mild to Severe Hidradenitis Suppurativa Week 16 data from OSIRIS, a Phase 2A open-label, single-center, single-arm, dose-finding clinical trial by Friedrichsen and co-authors. Our third article was Consistency of Convolutional Neural Networks in Dermoscopic Melanoma Recognition, a prospective real-world study about the pitfalls of augmented intelligence by Gossinger and co-authors. Our fourth article was The Mind-Skin Connection, a narrative review exploring the link between inflammatory skin diseases and psychological stress, by Biazza Suarez and co-author. Of course, all of the research presented today can be found in the Journal of the European Academy of Dermatology and Venereology, and though you can find free access and open access articles, EADV members benefit greatly by having access to all articles and content.
Before you go, a quick favor. If you're a regular listener to our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you're interested in hearing. To participate in the short survey, simply follow the link in the show notes of this episode.
Thank you for your support, it means a lot. We look forward to hearing from you. Until the next episode, take care of your skin.